Hi everyone, how you guys doing today? This is Untitled. I'm back. You guys don't know me, just look up a couple of my videos. I'm a third-year medical student, and I like to go over topics students find a few problems with. So today, I'm going to be doing this part 2 of portal hypertension. But before I start with that, I want you to go back and watch part 1, portal hypertension, because I went over the anatomy a little bit, talk about things you should be looking for, you know, a little bit of pathology, nothing too major, but this is a little more clinical. So if you just watching this video right now, I suggest you go back and just take a look at that video, and this will make a lot more sense because the structures are in place, and you kind of appreciate where things are going on. If I have to draw a few things on the board here and there, I'll talk about it. Just put a little schematic here on the board to kind of give me a thought process so we are kind of on the same pace, okay? So let's start with definition. I'm going to talk about liver cirrhosis for a minute. Your liver is the largest organ, like we talked about, and if there's any form of infiltrative disease processes that's damaging your hepatocyte, obviously what's going to happen is the cells are going to die. They're going to either become ischemic or they get necrotic. Once they become necrotic, the cells die. Once they die, they become, macrophages can come in, but it's not really macrophages doing the problem in this case. They're called stellate cells. And stellate cells, actually, if they get a signal, for example, alcohol damage, they start laying down fibrosis, basically collagen. The liver is not supposed to have collagen, right? That makes absolutely no sense. It's supposed to be a nice, soft cushion, be able to make, carry out its metabolic function. So, definition of fibrosis, liver cirrhosis, is the accumulation of, kind of like fibrotic scars, collagen inside your liver, thereby impairing its function. However, what is the most common cause of cirrhosis in the United States? You know it, I know it. If you don't, it's alcohol. Everybody drinks, right? I know. It's unfortunate everybody drinks, but it's not necessarily because everybody's drinking that's what's causing it. It's because it's long, prolonged, excessive amount of alcohol. People become alcoholic addicts and they can't get off it because of withdrawal symptoms, the tremor and everything. So they continue to drink. And what that happens is the alcohol starts to damage the liver. So I'm just going to write alcohol here for a second. It's kind of just the most common thing. So you hear about alcoholic liver cirrhosis or alcoholic liver damage. That's what we're talking about. Alcohol is converted to acetaldehyde, which eventually is going to, it's a toxin actually. Stimulate your stellate cell to produce fibrotic tissue. Now talking about that, just because I kind of like to draw, I'll draw it again. That's the liver. What happens is when alcohol starts to damage it, it becomes very fibrotic and kind of nodular. And basically it's just due to the fact that you've damaged this liver. And unfortunately, the portal vein, which basically drains into your liver, cannot really get blood through, right? If I put a lot of scar tissue right here, what happens? The blood can't flow through. That's the basic pathophysiology behind portal hypertension, right? That's why I wanted to talk about portal hypertension today. So, let me take you back a little to physiology, because sometimes students kind of forget, like, yeah, I memorized that physio class, man, it was crazy. I know it's important. You need to know stuff like that. I'm just going to put a little small schematic here just to kind of remind you guys. Remember when you have your little arterial system, which comes from your arteries, and they become capillaries, right? Exactly. Your capillaries become venules, which becomes veins. And capillaries are very, very small. Very small. I'm just going to draw them here. And you remember hydrostatic pressure, right? Hydrostatic pressure forces fluid out of your capillaries, right? In order to be able to exchange nutrients. And the oncotic pressure, which is basically the protein inside your capillaries, keep the water back in, so when the blood flows from an arterial through a capillary all the way out to the venous system, basically you're able to maintain that intravascular volume. On the other hand, what happens in alcoholic liver cirrhosis is you start to develop portal hypertension. What happens in this case is you lose the amount of albumin, right? Because think about it. If water is trying to get through or blood is trying to get through the venous system, it can't. It has to go somewhere. So pressure starts to build up. That's why we call it hypertension. The blood leaks out into what? To the peritoneum, right? So you get this huge belly, right? Because now you start seeing some people. It's funny in my country, like people think people with big bellies actually are rich. It's because they have a lot of money, they buy a lot of alcohol, they develop alcoholic liver disease, they start to develop ascites in their belly after a while, on top of obesity and a little bit of fat deposition, they start to develop fluid. So here's this guy's drinking, and his belly is big. What do we call that in medicine? We call it ascites. It's just accumulation of fluid in the peritoneal cavity. Why? Because think about it. Number one of the functions of the liver is to do what? Produce albumin. Extremely important. You need albumin. It's the most important protein in the body. It's carrying everything. It's the little guys working hard over time, carrying little hormones, proteins, bilirubin, and that kind of stuff. Your liver can't do that anymore. So if there's no albumin, obviously what were we looking at? A decrease in the oncotic pressure, right? We call that hypoalbuminemia, right? Because there's no albumin. So obviously if there's no protein inside your intravascular space, and on top of that you got a high pressure system, because I'm just trying to use this to mimic the capillary, the portal circulation to the liver. You build up hydrostatic pressure, the fluid starts to come out. The first classic sign, distension. Another complication, right, that you see is esophageal varices. What are varices? If you look at the last video, like I said, that's what I said, it's very important to kind of go back and see what I'm talking about, is because now blood is backing up. Now what happens is it backs all the way into the veins, and inside your esophagus are these esophageal veins. Their job is actually to drain your esophagus, drain them back through the portal circulation all the way back into the heart. Unfortunately, you get these dilated varices. How do we know that? We call the GI guy, he puts an endoscope down your throat, bam, right there, dilated, really torturous, kind of looking, you can kind of see them. So let's say this is your esophageal wall, you'll be able to see these things. This is dangerous, extremely dangerous. You know why? Because they can bleed. They can't bleed. It's vein, right? Remember when you did your histology? Like, oh my God, histology. I know. We'll learn about the tunica intima, the tunica adventitia, the tunica what? Externa. The problem is the veins are very thin, as you guys all know, right? It has the tunica intima, but the tunica adventitia is very, very thin, so it can really rupture. You rupture a vein. How do they rupture it? This is after prolonged liver failure. The pressure is so much. It backs up into the esophagus, the patient is coughing, right? They cough, and all of a sudden they lacerate one of those esophageal veins, and bam! It could be coffee ground, right? If it's just a little bleed, like sits in the stomach a little bit, the stomach acid breaks down the bilirubin and really discolors it. You get that coffee ground, we call it coffee ground emesis. Or it could come out as hematemesis if this really big. Imagine like somebody like lacerating a vein that's really bulging. The thing spurts out and the patient starts coughing up blood. That is one of the biggest complications. I'm going to talk a little bit about why that's even extremely dangerous. You know what? I'll talk to you guys about it in a minute. So let's just keep that in the back of our mind, because that might be the end result of the patient we're looking at. So if you drink alcohol chronically, by the end of this lecture, you might want to stop. Or if you're a medical student or listening to this, or just anyone, I encourage you, drink in moderation. Alright. Another complication, gynecomastia. Where's that coming from? Wait a minute. Gynecomastia. It's literally like a guy getting woman boobs, right? Exactly, that's what it is. We just give it a fancy name. Imagine a guy going to the beach, putting on his shirt, and you see a little two breasts on his chest. You're like, what? Are you kidding me? Yeah. What happens in the Holocaust?